We want to get right to it here because you made a news last night on Facebook Live. You're calling for a mask requirement in Sacramento County. We have not had that yet. It's just strongly suggested. So tell me about the mask requirement and how, if so, that could be enforced.
Well, the governor made a big announcement yesterday, Walt, in which he indicated that as early as Friday, businesses, retail, manufacturing, childcare could potentially open. And I know that Sacramento County will look at the state directive obviously very seriously. And I think we are on the cusp of a significant reopening of our economy, even beyond those categories. I think it is possible that in the next week or so, maybe a little longer, that restaurants and movie theaters and other venues may be open. So I'm concerned. I think it's the right direction, by the way, because the status quo cannot go on here. Too much hurt, too much damage to small businesses, to unemployed workers, to a society as a whole. But I am concerned that as we go back, that we don't do something that is going to then take us even farther back, that is going to lead to a spike in the virus. After all, Sacramento ranked first in the country in terms of the least number of infections per capita. And so as we go back, I don't want us to spike and then have to reimpose an order. So I think one of the additional protections that would help ensure that as we go back, that we do not have that spike is to make the mask requirement mandatory, at least for a little while, because it seems like a small sacrifice. We know that it is not foolproof, but it is an added layer of protection that would certainly make me, and I think make people, feel a lot better about opening faster.
Let me ask you this. You mentioned that you're anxious to get back because obviously we can't sustain business. Do you feel that you and the governor, or let's just say the governor, is being pushed because business needs to restart? People are getting restless. Do you think that you and the governor would prefer more time for health reasons?
Well, I think the public health comes first, but no, I don't think we're being pushed as much as we are both and all genuinely concerned about the real life impacts on people who are out of work, whose businesses are about to close. You know, I've even been in conversations with some of our hospital and healthcare leaders who say that they are having a hard time convincing people, for example, who may have chest pains or other conditions to go to the hospital or to go see a doctor. And so there's a public health consequence, if you will, to continuing the status quo in the way that it is. And so it is certainly not political pressure, because I know I can withstand that. And I know the governor can as well, because it's got to be about doing the right thing. But it is about that balance that we all struggle with, because we don't want to see another person die of coronavirus. And yet the status quo, where everything is shut down and unemployment rate could be 20% and people are really suffering, we have to, at least in a controlled way, try to bring it back, but do it in a way that is as safe as possible.
Okay, let's talk about testing. That's a question coming in right now, 916-321-3310. The city, the county, they're doing testing right now as opposed to the last time that we talked. Where are we with all this?
Well, we've increased our testing. We're, I believe, at about 1,000 a day in the county, and we're testing every homeless person in one of our existing shelters. We're also testing seniors in senior living facilities. And I know that the county and Dr. Bielenson is soon going to announce a number of community clinics where people who do not have symptoms can get tested. And we're especially focused on our communities of color that have been disproportionately hit, if not in Sacramento, certainly throughout the country. But the truth of the matter is that we're not going to get to the level of testing, not just in Sacramento, but in the state or in the country, that is going to allow us to make an absolutely safe decision based on the testing in terms of reopening. we're going to be able to essentially get representative samples, and we're going to be able to do the so-called contact tracing to figure out who those who have tested positive been in contact with, and make sure that they stay isolated for a couple of weeks. So the testing is only a part of this. It's got to be the protocols around safe distancing, even when we open up. And yes, I think masks would be an added layer and level of protection.
All right.